John Edmunds, there's been a big increase in deaths in care homes. Do you estimate from the modelling you're doing that deaths in care homes will carry on going up, that we're not yet at the peak of the epidemic in care homes?
It's likely that the epidemic occurring in care homes will be behind the epidemic, the main epidemic, by some time. I think, not from data that we've been looking at ourselves, but from colleagues up in Manchester, they suggest that the numbers may be flattening now. So it may be just starting to peak in care homes. At least we hope so. We hope that's the case.
Should the government have done more then to collect the data in the care homes to try and get ahead of the curve there?
I think yes. I think it's been very difficult to really get a handle of what's going on in care homes. The data are collected, but it's not been the easiest sort of part of the epidemic to get a hold of, to understand properly. So I think yes, more data collected in a better way earlier would have helped us. Of course, it would have done.
Was it not seen as a priority then? What was the thinking behind that?
I don't know.
I mean, what do you estimate, if you're able to say, I don't know whether you're collecting this kind of information, but what do you estimate that the reproduction rate, the so-called R figure, is in care homes at the moment versus hospitals and the general population? What are the comparative figures there?
Yeah, well, this is one of the issues. So we can't really estimate it using data from the UK. It's very hard to do it. So the way that we've been collecting the data, as I say, hasn't really allowed us to be able to get an estimate of reproduction numbers in that setting. You can look at data from elsewhere. So there's not very much data out in the literature, but there are some studies, particularly from the US. So you can get some inference about what it might be, but it's very difficult to make any clear estimates from data from here in the UK.
Are there any, as we look now, Boris Johnson's talking about coming into the second phase of this, as we look towards lifting the lockdown, exiting from the lockdown, what might be the first measure that could be lifted, in your view?
Oof, that's a tricky one. I think I certainly wouldn't lift anything related to care homes. We need to do better in terms of shielding our vulnerable population rather than think about lifting any restrictions.
Well, how do you do that? Just to pick up on that point, how do you shield the elderly more effectively than we're doing now?
Well, one thing that was announced today, which I was very welcome, is the testing of individuals in care homes, whether they're symptomatic or not. So these are staff and residents, testing of those, regular testing of those. Now, the government didn't say how regularly, but nevertheless, that would give us a better idea about or be able to pick up infection in care homes earlier than is currently being the case.
And so, if you're trying to carry on protecting the elderly or protect them better than we have done to date, what are, or are there not, any measures that we can lift from the lockdown? Does that lockdown now have to stay indefinitely?
Yeah, I mean, probably the best way to protect our most vulnerable people is to drive the numbers of cases down in the community, because that they have to pick it up from somewhere, and they tend to pick it up either from the community, so maybe members of staff coming into care homes, or who've picked it up from outside, or picking it up from hospitals. And so if we drive the numbers of cases down, we'll drive the numbers of cases down in hospitals as well. And then the most vulnerable people, such as residents of care homes, who often do have to visit hospitals or get hospitalized for other reasons. And unfortunately, that's very risky. Then they can pick up infection if there's not very good infection or not perfect infection control in the hospital environment, then it's a risk. And so the best way that we can protect our most vulnerable people is to drive the numbers of cases down in the community and hospitals generally.
How far down?
As far down as we can. The further we drive it down, then the lower the risk is to everybody, to the highest risk people in the population.
So does that mean that any easing of the lockdown will result in some kind of second wave of infections?
No. You can ease the lockdown and still keep the numbers of cases low. So what we'll probably see is a switch in our approach. So rather than having a general lockdown and where everybody is locked in their homes, we'll ease restrictions a little bit and replace that with this sort of test and contact trace strategy. And so the idea is you would maintain levels of infection very low, but switch the way that you're doing it.
So does that mean that this idea of sending the schools back, is that possible? Does that risk a resurgence of the disease?
It is. Of course, it carries some risk. It looks as if children play a very small role in the transmission of this virus. And so it may be that allowing schools to go back and maybe there's innovative ways that you could allow schools to go back. It doesn't mean to say you just necessarily have to open all schools and return to normality. You may be able to do it in such a way that or just open primary schools, or just open secondary schools, or something else, so that they're partially open. So you can do it in such a way, perhaps, that minimises the risk. And all of these, the sort of options that are being looked at by colleagues in the modelling world and looked at by policymakers at the moment.
So what is the least risky easing of the lockdown according to your modelling and your colleagues' modelling?
Well, every single easement of the lockdown carries some risk. We know that the lockdown works. It's reduced numbers of cases. It's caused the epidemic to peak, but that's only a temporary peak. That's only that peak is only there. That reduction is only there because of the actions that we continue to take. So if we ease those, then there is some risk. There must be some risk attached to that. But of course, we have to balance this with the other health risks of keeping the lockdown in place, and of course the enormous economic risks of keeping the lockdown in place. So all of these, you're kidding yourself if you think there isn't some risk attached with these. There is some risk, but the idea is to try and reduce that and to bring in these extra measures, the contact tracing and the testing measures, to replace some of those, some of the measures. So we would, instead of having a mass lockdown where we're all, most of us are restricted to being at home, by doing it, by putting in contact tracing very actively, then quarantining of contacts of suspected cases, then you'd have the highest risk individuals, as it were, who are still in lockdown, and others may start to go back to more normal life.
If the UK ends up, as it's warned we might, with the highest number of deaths in Europe, why do you think that would be?
I think that's putting the cart before the horse. I think we'll have to wait until we see, I don't think you can really calculate those things until after the epidemic is over. But the UK is a sort of slightly higher risk population than many others in Europe. We have a quite high proportion of the elderly in the UK, and we have a high fraction of individuals with these other conditions, these chronic conditions, including obesity.
Did scientists, though, offer the wrong advice on lockdown to the UK government? Should the UK have locked down earlier?
I mean, it depends on how you view what this, in terms of what a lockdown is there for and the duration of lockdown. If you're going to lock down for permanently, for very long periods of time until you get a vaccine in place, then the best option is to lock down immediately from an epidemiological point of view. If you take just a very narrow epidemiological point of view, then the best option then is to lock down immediately and to keep everybody in lockdown until or if a vaccine becomes available. That's a bit unrealistic. And if the strategy, or if you can't do it for a very long period of time, then perhaps you have to time that a little bit better. So, so waiting a little bit and then asking people to take these really rather extreme measures might be the better approach. So it depends. Yeah, it depends what you think is feasible and how long you might, or how long you think that people can stay in this situation for. And it is, of course, very difficult to stay in a lockdown for very long periods of time.
But do you think you attempted to mitigate the disease rather than suppress it for too long?
I don't know the difference between that.
Well, of course there is a difference. You know, you're mitigating, you're containing it rather than squashing it completely.
I think that's just semantics, isn't it?
Well, as far as I understood it, there's a clear difference in the SAGE documentation between mitigation, a mitigation strategy, and a suppression strategy.
Well, you're just trying to reduce the numbers of cases.
Well, when you suppress it, you can reduce the reproduction rate below 1.
Yeah, I mean, clearly that's the better way to do it, is to reduce the reproduction numbers. Of course, you want to reduce the reproduction number to below 1 and maintain it there if you possibly can.
But do you believe, I mean, did you change your mind on herd immunity?
No.
What is your...
I don't know what you mean by that. Herd immunity is just a thing. Yeah, herd immunity or population immunity is what all epidemics of this nature will eventually come to an end when you reach a certain level of immunity in the population. And there's 2 ways that can happen. One is by natural infection, and that's by far the worst way of doing it. And one is by vaccination, and that is by far the better way of doing it. And that's how epidemics eventually come to an end. And that's the same for any epidemic of this nature. You know, you could allow a measles cases to occur, or you could vaccinate to prevent measles. It's exactly the same. Vaccination is by far the better way to do it. But the epidemic of measles and the epidemic of COVID comes to an end, finally comes to an end, when you don't have to have all these other restrictions and so on in place, finally comes to an end when levels of immunity in the population are such that the transmission chains are broken. And the best way to do that is through vaccination. But there's no vaccine right now.
But for a period in March, the government appeared to be pursuing a strategy of mitigating the spread of the virus, allowing Cheltenham races, for example, to go ahead between March the 10th and March the 13th, allowing it to spread naturally, to allow the development of some herd immunity. Was that a mistake?
I don't know. I'm not quite sure whether that really was the strategy. I think that at the time it was difficult to imagine, we weren't sure by what levels of compliance with various social distance measures were possible. It hadn't been done in the UK or even in Europe up until Italy then started going into lockdown around the middle of March. And I think that changed things. I think that changed the way that up until that point, you'd seen very restrictive measures taken place in China, and I think it was hard to imagine that we would do that here in the UK.
Was that why you didn't model full lockdown until the middle of March?
I think it was very hard. I don't think anybody looked at it. It wasn't just myself. I don't think anybody. We all looked at a range of different measures, some of which were very stringent. But it was, it's difficult to say, but it was difficult to imagine just how, well, in some sense, it was difficult to imagine just how easy the lockdown was, if you see what I mean. That people actually would go along with it.
So if you'd known how compliant the British population would be... No, but if you had known, I'm just saying, if you had known, looking back now... We
couldn't possibly know that. We'd never done this before.
But if you had known, you would have recommended lockdown earlier.
We couldn't possibly have known that.
No, I'm not suggesting you could have known it, but now you do know it. Do you think it would have been advisable to have imposed lockdown earlier? It would have saved lives.
There's, as I said, I think you've got to make a balance, and thankfully I don't have to make that balance, but people have to, politicians have to make those decisions, and make that balance between what might be, if you look just narrowly at COVID, then the best thing is to keep people in lockdown and not to release people from lockdown until there's a vaccine. But that's taking a very narrow view, and far too narrow a view. You can't do that, and so you have to balance them off, that off with other things, with other strategies, and with other things. I mean, other health implications of locking people in their houses and their homes, and the clear economic implications which can't be ignored, and they subsequently have other health knock-on effects, going down the line.
Do you think it was right and proper that Boris Johnson's chief advisor, Dominic Cummings, was involved in SAGE meetings?
Look, I think it's important that civil servants are present, that attend those meetings, because otherwise it'd just be a bunch of scientists talking to each other with there wouldn't necessarily be known what was discussed and so on. So I think it's important that the civil servants listen in, attend those meetings and listen in.
I mean, he's a political appointee.
I don't have control about who, which civil servants listen in. I don't have any control over that. And if that means that attention is being paid at the highest level, I don't see a problem with it.
So you didn't feel it undermined the sort of impartiality of your advice and other scientists' advice? The
way it works is that the scientists speak, and the other attendees listen in.
So he didn't try and shape the discussion at any point?
No. Occasionally there's an interjection for a clarification or something like that, but the committee is run by is chaired by scientists, and it's the scientists who speak.
So the scientists are in the driving seat at all points?
Yeah.
And do you think there is the fact that scientists and politicians are standing alongside each other at press conferences? You've got Dominic Cummings, involved in SAGE, albeit, as you say, as a listening in. Do they compromise each other? Do you fear they might, the scientists and the politicians?
I don't think so. I'm struggling to think. I don't think so.
And are you concerned about the transparency of SAGE? Do you think the names of SAGE members should be made public, that the minutes should be released, on a sort of rolling basis?
I mean, I do think that the membership should be public. It's sort of leaking out now, but yes, I think it should be public. And I think wherever possible, the meeting notes should be made available. I can see why sometimes they couldn't be. I think that is understandable, but I think the more openness we have, the better.
John Edmunds, thanks very much.